Welcome to the Compounding Center Connections, where we talk about different health conditions with our partnered practitioners. I'm your host, Jay Gill, a compounding pharmacist from the Compounding Center in Leesburg, Virginia. At the Compounding Center, we collaborate with practitioners, create custom medications to help our patients get better. The information discussed in today's episode is for informational purposes only, not for diagnosis. So I'm excited. In today's episode, we have Jennifer Gularson, a physician's assistant with the Osteopathic Center of Healing in Rockville, Maryland. So today's talk is on peri-menopause and the use of the Dutch test to help diagnose and monitor bioidentical hormone replacement therapy. So Jennifer, before we get started, could you please introduce yourself to the viewers and the listeners?
Well, thank you so much, Jay. It's great to see you. Hopefully we can see each other in person soon. I'm sure everybody says that to you. Yes, I am a physician assistant. I've been in practice for over 20 years, which is very scary for me to say. The last 15 years, I've been practicing aesthetic medicine, which is sort of the fun stuff, Botox, fillers, microneedling, lasers, and as well as bioidentical hormone replacement for both men and women. And I have I'm board certified as a physician assistant, but then I also went through the IFM training, the Institute for Functional Medicine training, and I am board certified in functional medicine as well. So I've been in my Rockville location for a little over a year, and I really appreciate you highlighting smaller practices like ours because I feel like we do really good work and we've been here and people need our help.
Well, to give a little bit of background to our viewers and listeners, we met at a low-dose naltrexone conference about 3 or 4 years ago and connected. And since then, we've kind of teamed up and helped many patients. And you've expanded into aesthetic procedures now, so we'll talk about that a little bit later. But so describe your practice and the types of patient you see, or tell us a little bit about why you do what you do.
I started out in family practice and then went into oncology, which I really, really liked. And then I was practicing oncology and I got pregnant with my third kid. These are all my kids in my background here. Got pregnant with my third child and just the lifestyle wasn't leading me down a path that was conducive to having 3 kids. So I found a practice in Frederick, Maryland, and I was thankful to be sort of embraced by these 3 amazing women who are all sisters and own this practice. And it started out as a med spa, but then we quickly expanded into the functional realm and the hormone replacement. So I feel like, and I was just talking to someone this morning about women in this peri-menopause state, and these, their periods haven't quite finished, but they're having all these symptoms, and they go to physicians or their providers, and they just are told, well, your tests are normal, so you must be fine. And then finally, they sort of end up in my seat, either me injecting them with Botox because they wanted to get rid of this wrinkle or whatever, or because they're just looking for answers that they just haven't found anyplace else. So when we started with the aesthetics, you develop a relationship with someone, and when you're causing them a teeny bit of pain, there is a camaraderie, or you kind of develop a close relationship. But then it just lends itself to like, hey, how are the kids? How's your job? And that opens up into, I'm not sleeping, I'm getting hot flashes, I can't lose weight, I'm upset with how this looks. And then that starts a conversation into, well, have you had your hormones tested? Well, yeah, my doctor did it, or my provider did it, and they're all fine, but I just feel like something's wrong. So there's a nice space for us to talk about the things that maybe they don't even talk to about their girlfriends.
That's awesome. That's awesome. So, let's say, a patient is there, you're talking to them. How do you approach your therapy with hormone imbalance? What's your approach?
So at heart, I'm a functional medicine practitioner. So we always start with that foundation. What are you eating? How are you sleeping? What are your stressors? How are your relationships? And are you exercising? So a lot of patients are surprised that I really spend a lot of time on those foundational things. However, if that's not solid, any of the little things and tweaks that I'm giving you and or suggestions are probably not going to be as effective. So really getting those lifestyle changes down and really solid is paramount. And then I always do traditional testing that you can do, like usually at LabCorp request or the bigger labs. And then we go into some of the specialty testing, of which Dutch is one of many. I do stool testing, I do nutrient evaluations, I do genetic testing, just based on where we're starting and what the goals of the patient are. I have a lot of patients that are feeling pretty good and they want to optimize. So that's where I'll do some of the genetic testing and the nutrient testing. But then I have some people that we're just trying to investigate why we have these problems. So that's why I'll do Dutch testing or stool testing. But specifically for hormones, I really like the Dutch test because it offers a very broad range of hormone, not just your sex hormones, but also your adrenal. And then it gives you a lot of good information to glean off of that. And then if you're starting on a replacement program, it helps me to safely decide that we can do that together. So it's a very collaborative, we talk about the goals and the feelings. Usually it's a 90-minute consultation where I start from childhood all the way to where we are now and maybe discover some things along the way that may have got you to this point.
Gotcha. Now, you mentioned a couple of times the Dutch test. Could you explain what, we know what it is, but could you explain to the viewers and listeners what is a Dutch test or, how it's done?
So a Dutch test is an acronym. It stands for Dried Urine Test for Comprehensive Hormones. And it's a urine test. So you're peeing on a little strip, a filament of paper, 4 to 5 times during a day. And the fifth time is like if you wake up in the middle of the night with your hot flash, you need to go to the bathroom, you pee on that strip. And it really gives us some insight not only to the levels of the testosterone, progesterone, and estrogen that everybody thinks of, but it also gives us insight into how you metabolize all those hormones, which may be giving you some of the symptoms that you're experiencing. For example, some patients with polycystic ovarian syndrome are found to have high testosterone, but it might not come up in a lab test, a regular blood lab test, because in our blood, our hormones are sort of attached to, I call them little Ubers, these little proteins that take them around. So specifically with testosterone, it can be either bound to sex hormone binding globulin or albumin. So that's a measurement of everything. We don't know how much of those sex hormones are free to help you feel better. So that's really important with, especially like men and testosterone. But you may have one number on your serum test, but then you have a completely different picture from the Dutch test. So it helps us measure those hormones that we said, cortisol, and your cortisol metabolites. So somebody who's making a ton of cortisol because they're stressed out may be sluggish in metabolizing it, and it can cause some belly fat, or they can be super fast at metabolizing it, or they could be not making enough at all and they're sort of exhausted all the time and they're gobbling it up fast. So it really does give us some insight. And for me as a practitioner, if I'm going to replace some of these hormones, I need to know how they metabolism, because if I bump them up, I don't want to give them things like acne, hair where they don't want it growing, hair, losing hair off their head, those kinds of things.
Yeah.
Or aggressiveness and things like that. You just want to make sure that you're doing it in a safe way.
So you see men also at your practice, since you talked about testosterone there with men, right?
Yes, yep, we do. I see them. I feel like a lot of times if they come in by themselves, the wives come quickly after because they're not on the same page. So yeah, seeing men, they're a little less difficult because you don't have to balance a whole bunch of stuff. But again, for men, these professional men who are trying to keep up with the younger men, they wanna be, thinking as clearly as they used to, recover from their workouts. They're usually well, not so much anymore, but out on business dinners and stuff, and then they want to be home and be able to be active for their kids, but they're just doing way too much. So again, those fundamental things like sleeping, eating, exercise, stress, and mitigating some of that low-hanging fruit, if you will, is really essential. And then replacing things that they need if we find in their blood work that they need them.
Okay. So going back to the Dutch test, how often do you actually have to do that test?
Yeah, so I do it. I usually will do it initially just to see where we are. If they're
Okay.
truly postmenopausal and have been postmenopausal for a couple of years, then I kind of start out with a blood test because I know it's all going to be low. I start out with a blood test, maybe start them on some sort of hormone replacement, and then test them to see how they're metabolizing it then. For people who are still menstruating, it's nice to know where they are in their cycle, and that gives me a good idea too. So usually one to begin with, then I'm comfortable monitoring with the blood because I did that for many, many years before Dutch was around. And then maybe every year and a half or so, I'll redo a Dutch, and then especially if symptoms change. So the one thing about perimenopause is that you're not yet in menopause. So a lot of times you're fighting, if we're giving some hormones, your also body is still making some when it feels like it. So it's sort of balancing until the ovaries completely stop, and then we sort of take over from there. So during that perimenopausal time, we see each other pretty often, maybe once a quarter, once every 6 months, just to check in and make sure things are going well. But all in all, I feel like patients, they sleep better, the anxiety and the ruminating thoughts and all those things with the combination of the lifestyle changes, it really does help improve their quality of life.
Now, once you get all the testing back and you kind of know what you want to replace, um, could you talk to us? What is your choice of dosage forms that you usually go with? Topical creams or oral or pellets? Could you talk to us a little bit about that?
Right. So this is where the collaboration really comes in because it depends on the motivation of the patient. I find that men typically do not want to put creams on every day. So a lot of men either do injections or pellets. And with men, we're typically, aside from all the supplements and stuff, we're typically just replacing testosterone. For women, of course, we're a little bit more complicated. We require a little bit more flexibility, and we have that. I typically do not do any oral estrogen, but as far as estrogen goes, there are patches, there are creams, there are creams that you put on your body, there are vaginal preparations, and then also pellets. Progesterone, I typically either am doing a vaginal suppository or, and most all the time, an oral form of that to help with the sleep and anxiety portion of menopause and perimenopause. And then testosterone for women, you got it all. You can do a cream, you can inject it, and you can do a pellet. And the great thing in about having all that flexibility is after 6 months, you're like, you know what? I want to switch this or what, we can do that. You're not completely only have to do it one way. I have patients that do pellets for years and then take a break, and then we augment with patches and stuff. So I am a big proponent of using a bias, using the estradiol and the estriol together. I think that's a better complete uh, uh, hormone replacement, and I only do use bioidenticals. So that's exactly, like, I'm sure probably half your audience know what bioidenticals and half don't. So bioidentical hormones are exactly like what your body is used to making. A lot of things like we know about Prempro and birth control pills. Those are all synthetic materials. They're your body. And I tell patients, it's like, you have hormone receptors, and the hormones, they go in like a key. Well, bioidentical and synthetic hormones sort of look like the same key that'll fit into the lock, but one of them opens it and one of them just sort of sits in there. And that's the difference. I feel that the bioidenticals are safer. Sometimes they're a little bit more expensive because you have to get them compounded, but establishing great relationships with their compounding pharmacists, you're getting really good care, and it's for me, it's a better way to go for my patients, and the symptoms, the side effects to the medicine aren't as great.
Well, thanks for explaining the term bioidentical. We should have started with that in the beginning. But now, outside of hormone replacement therapy, what other, you talked about lifestyle changes. What other supplements and vitamins do you tend to also kind of utilize as part of the therapy?
So I do a lot of traditional blood testing also. So we always, check the big guys, the vitamin D, your B vitamins. The Dutch test does give you some organic acid testing to give you an indication for B vitamins. So that's good too. We double dip on that. But I also do thyroid. I call it thyroid optimization, because sometimes normal isn't always optimal. And a lot of women, either because they've taken birth controls for a long time and they're deficient in their B vitamins, because we know that birth control pulls out their B vitamins, they might be fatigued or have a little bit of depression. And we want to make sure that we replace those. And it's vital in your conversion from T4 to T3. So within a thyroid picture. So I'm one of those people that order all 9 available thyroid tests, and we look through and piece through and make sure that just because your TSH, just because your brain thinks you're doing okay, is your body doing what? Does it have the necessary ingredients to transform what the thyroid is making into usable parts? And that's really important. I think a lot of people, and a lot of young people, because of stress, because of vitamin deficiencies, aren't able to do that conversion and then actually get their thyroid hormone into their cells. So those are where those levels help. So yes, I do supplement. I tend to do a lot of supplements at the beginning until I can get their diet back on track, and then I always try and start with diet. So a great example of this is like iodine. Everybody's low in iodine, but you need iodine to make a really good thyroid. There's three iodine molecules on every T3 molecule. So if their iodine is low, I'm like, okay, well, let's look at the sources of iodine in food. I don't tell anybody, I grew up in Maryland, but I don't eat seafood. So the number one thing is like seaweed, because salad, kelp, and all that stuff, and sushi. I don't eat that. So I'm going to be the one that's taking the supplement. However, if they're like, oh my gosh, I love that, then I'm like, okay, switch to Himalayan sea salt. It has a little bit of iodine in it. Try and get it from food, but sometimes you can't.
Well, you talked a little bit about nutritional deficiencies. So, being a functional medicine practitioner, what are some of the other things that you also handle?
So gut health, that's a big one. And sort of the mantra in my world is, if in doubt, start with the gut. So I do gut testing, and sort of talk about what you're eating, how you're eating it. Are you chewing your food? How do you feel after you eat it? Do you get bloated 2 to 3 hours? Do you get reflux? I talk a lot about bowel habits, like, are you pooping every day, and what does that look like? And people are like, I can't believe you're asking me this. I'm like, how am I supposed to find out if I don't ask? So all conversations are totally fine with me. So gut health. My colleague is really good at Dr. Spiegel, you know him. My colleague is really good at complicated cases. He does some of the Lyme testing and mold testing and some of the more complicated things. So a lot of times I'll start a process and be like, you need to see him. We do IV nutrition. So if somebody's having a lot of gut problems and they want to bypass their gut, we do Myers and GI cocktails. We do NAD plus infusions. So it really does run the gamut. Sleep disturbances, genetic testing, all those, we do all that stuff. But I'm sort of, my passion is helping these women and men who just feel like they're alone in their symptoms.
So, Jennifer, are you now seeing patients in person, or are doing like a hybrid also, like telemedicine and in person right now?
So thankfully, if a lot of my patients are coming back in person, but I've found a luxury in, especially in the cosmetic part, I can do a Zoom video and we can talk about procedures. And then that means that, and then we can come up with a game plan, and then they just come in for their procedure. So obviously, if someone's getting an injection or they're getting pellets, they have to come in to see me. But I am seeing people over, Zoom as well.
Okay.
I love seeing people. They bring me energy, so I'm happy to see them in my office. but understand if they don't want to either. So some people I try and limit. Like if they have to come in for a blood draw, then I'll just see them quickly, and then we can follow up with tests over, Zoom if they want to. I do like to lay hands and just look at, why are you looking at my toes? Well, I'm looking to make sure that everything looks good. I want to look in their mouth. I want to look in their ears and just get a full picture before I make any assessments or any recommendations.
So could you tell us, how can someone reach out to you?
So our website, I'm sure you'll put a link in the podcast, but our website is a great way to make contact and find out. I have my own website. It's called yourbesthealthwithjennifer.com. So that's pretty easy. Yourbesthealthwithjennifer.com. I'm on Instagram. It's just my name on Instagram and Facebook. You can reach out that way. And then you can always actually call our office, and our lovely ladies will take care of you and figure out what you need.
Well, Jennifer, thank you very much for taking the time and being part of this episode. We'll make sure in the description of the episode, put your website URL link in there. And
Awesome.
Thank you, everyone, for tuning into the Compounding Center Connections podcast. We hope you found the information presented today to be helpful to you and or someone you know. If you have any questions or comments, feel free to reach out to me at j@compoundingcenter.com. Thank you. Thank you, Jennifer.
Awesome. Thank you so much. It's fun. It's so much fun talking to you about this stuff.